Jacqui is up next. Jacqui Curley, Head of HIPE and NPRS at the Healthcare Pricing Office, and she's going to give us the HIPE update. Thank you very much, Jacqui.
Thank you.
And thank you for keeping us hydrated. Very important.
I'll do that as well.
I'm kind of laughing at Jerry, but you know the way all those children come into the children's hospitals and they're sent home again? I remember once one of my kids' arm was actually broken, and I grew up on a farm. My mother was a nurse, which meant the leg would have to be half amputated before she'd approve if you go into hospital. And she actually thought I was being hysterical going off to Temple Street. The child's arm was broken. But there is a big issue there, isn't there, around kids? And I wonder, when we're talking about avoidable admissions and, you know, preventing people from going into hospital in the first place, how do we educate parents around that? It's a tough one, isn't it?
It is, yeah, because we live in a time of great anxiety.
Yeah.
You know, listening to all these stories all the time about
Yeah.
something that turned out to be something nasty.
Yeah.
Whereas most of the time it's not. Alf Nicholson, the first clinical lead of the paediatric programme, used to always say, we've never had as many healthy children.
Yes.
And we've never had more going to hospital. It's complex, I don't
Yes,
really
sorry.
take-
I was just diverting while they were doing the glasses there. Okay, Jacqui, so HIPE update. Thank you.
Thank you very much.
Yeah.
Good afternoon,
Yeah.
everybody. So I am just going to give you a little update around what is happening in the world of HIPE that you have heard so much about during the day. So HIPE is the Hospital Inpatient Inquiry, and it's been around for more than 50 years, a bit like myself, more than 50 years, and adapting and developing and, you know, becoming... I think it's coming into its own really now with the data being used so widely. So I just want to give a little update, but really I put that picture up because I really want to emphasise, I don't often get to talk to this wide of an audience. So I just want to take the opportunity that this is about opening the door on the data. This HIPE data is how your hospitals or your services activity is viewed by the department, by the HSE, by funders, by whoever is looking at the health service in Ireland. So it's really important that you are aware of the data and that you know what goes into it, you know what the challenges are, you know where it's coming out at the other end and how it's been used at the other end. So they're kind of the areas I'm going to touch on today. I've listed them there, but I will be going through them on the slides. So just to start off by saying 2024 was our largest ever HIPE national file. We had over 1.9 million discharges. And incredible credit to the HIPE coders out there. They coded 99.3% of that 1.9 million. We had about 13,500 uncoded cases, which was 0.7%. Now, there is a change where the value of those uncoded cases, for those of you in the funding and the finance world, the value of those uncoded cases, it has decreased from 80% to 60% of the CMI. So you kind of get a basic payment for those uncoded cases, but that has reduced. So you need to be aware of what's happening in this space. So that annual HIPE file is a static file. It's used for reporting, it's used across the healthcare system, it's used for lots of different things, but that's a static file. So we create one of those every year based on what's come in for the previous year, and we close the file at the end of March. So 2025 is open now, that will close at the end of March 2026. And there has been an overall increase of 10.6% from 2019 up to 2024 in the HIPE data that's reported. And I've put it in there on the slide. So you can see the huge volume of day patient activity, the inpatients and the mean length of stay as well there. So that information is available. It's up on our website. The 2019 and 2023 are from the annual activity in acute public hospitals reports, and the 2024 is preliminary because that report is just being done at the moment. Now, some sites struggled to complete 2024, and we're very aware of that. There are often factors beyond the control of the HIPE team itself. It needs management, regional, national input into managing that demand for data versus the challenges in capturing and collecting that data on time, good quality data. So I'm just going to talk now about the HPO and where we fit, and basically we're kind of at the bottom of that pyramid. We're there to support and enable and really kind of behind the scenes for the HIPE data collection in the hospital. It's your data, it's your hospital's activity. We provide the systems and the enablers for you to collect and capture that data for it to be reported on. So we have ongoing delivery of coding audit, training and data quality in terms of HIPE data collection. And you've heard about the ABF deep dive audits across the 6 sites. So our element on the HIPE side of that is to do coding audits. Now they will be based on 2023 data, so it's a point in time because we've changed classification since then. So it's a point in time on 2023 for those 6 sites. We'll also be looking at the quality of the admin data. We'll be looking at documentation, the quality of the documentation, and the overall quality of the healthcare record. And these are things that HIPE teams on the ground often report to us as being their challenges. So these are some of the things that are factors that impact the quality and, I would strongly say, the efficiency of coding. So if the pressure is on your coders to meet deadlines and get those 1.9 million discharges coded, how do we enable that and how do we allow that to happen as best as possible? So just to mention procurement, we're in the final stage of an extensive national procurement process for a HIPE data quality assessment tool. So the successful tenderer is Beamtree with their PIC product, and they are the incumbent. They were previously providing that service. So that was an extensive procurement piece, and we're in the final stages of that contracting piece in the procurement process, and we'll be rolling that out once that contract is signed, and there will be enhanced features and reports there available. So they're available within HIPE departments, and we'd also expect management to have some eye on those reports as well, but we will do more work on that once that contract is signed off. So we're also our ongoing HIQA work on information governance and standards around data quality statements. We're asking all hospitals to complete a data quality statement in terms of their HIPE data. And we also are continuously working on HIPE data awareness around the system and supporting HIPE data users at national level. And you heard a little bit this morning about the National Sepsis Programme, and we're so delighted to work with them, and the coders in all the hospitals are delighted with that as well. And we also work very closely with the National Clinical Programme in Anaesthetics, who produce an annual report on anaesthetic activity based on HIPE data, and thanks to them for their support and championing HIPE data as well. We work with various programmes across the HSE. I just put some of them there, the chronic disease management. We work with the HRB. We deal with parliamentary questions, all of those pieces around what's happening in the health service, or how do we build those programmes up to use the data more. So across the HSE, some of the newer developments, the procedure data from HIPE is the work is going on now to look to include that in the National Shared Care Record. There's also utilisation of HIPE data in national clinical audits around sepsis, and also with the NCCA, the National Centre for Clinical Audit, around the National Falls Audit. The Patient Care Experience Survey are now looking to use HIPE data to identify patients to be included in the Patient Care Survey, Cancer Care Survey. And also the HSE bed management system will include an element around HPO ward registration as well. So we're delighted with that because it gives us a link in around the ward registration. So NOCA are champions of HIPE data as well and heavily utilise HIPE data. So we're delighted to have that ongoing work with NOCA and HSE internal audit as well. New developments also include the surgical hubs. So there's one up and running at the moment, which is fantastic, and we're looking forward to the rest of those being rolled out. There may be challenges around coding resources and chart flow. The first one that was set up had an EHR in place, made it quite easy. However, it might not be as easy in other sites where there's no electronic healthcare record. So that will be, we'll deal with that one when it comes to us. Acute virtual wards, so we're also working with that programme around admitted patients being managed at home. So just a little bit on international, what's happening internationally now. The coders might be more interested in this piece, but Ireland, we're currently using 12th edition of ICD-10 AM, so that's the Australian modification of the World Health Organization's classification. Australia are currently using 12th edition as well, but they're moving to 13th edition on the 1st of July. So the main change that they're bringing in is around the clustering of codes, and that's a kind of a early step towards ICD-11, where codes that are related are linked together. So for example, an injury will be clustered with the external cause codes for that injury, and that's to aid reporting and data analysis. So that's one of the main changes they're bringing in 13th edition. We did submit, we did a submission to the Australians on 13th edition on an early information piece that they asked for feedback on. So we just fed back on some pieces in that. Now we're not licensed for 13th edition in Ireland, we're only licensed for 12th edition, but we will keep an eye on what's happening there so that we're able to keep the coding community informed and that we know ourselves what's happening internationally in that space. ICD-11, so that's been released for a number of years now by the WHO, but it's diagnosis only. They are working on an international classification of health interventions, but we would need a grouper as well for DRGs. So Australia are, it's going to be after 2031 before Australia implement ICD-11, and they have a task force set up, and they're looking at different projects around it now, including cost-benefit analysis, system requirements. So it's a huge piece to move to ICD-11. It'll be a massive change in the system, a massive change to all the reporting that you've heard about so far today. So it's a huge piece. So we are monitoring that, and we're linked in with the Australians. We're linked in with our colleagues in the Central Statistics Office who use ICD for mortality reporting around death certification. So we're just keeping an eye on that space as well. So just to mention the European Health Data Space regulations. So this regulation is enacted now by the EU, and this will assist with interoperability, sharing and linking of health data across the EU. So that's a massive EU-wide project around health data. So it will align with the Health Information Bill when that comes to pass, I think is probably the right phrase for that. And there will be a health data access body in each country. A HDAB is a new acronym for us all. A HDAB in each country. And HIQA at the moment are leading into the preparedness and the getting everything ready for that. So we're linked in with them. They have these work packages, and we're linked in with them. But it's around that secondary reporting of data and how it's going to transfer around the EU. And it's beyond just HIPE, it's huge health information. And I just wanted to mention as well around electronic healthcare records. So we do have pockets of healthcare records in Ireland around, someone mentioned it earlier, the MNCMS for maternity and newborn. It's in 4 sites, soon to be 6 sites. There's a mix of EHRs, there's paper, there's hybrid, there's all sorts of things. But there is a recognised need for a national EHR, and if that's something you're interested in and you want to learn more about, there's the Digital for Care framework from the government, and there's also the HSE's Strategic Implementation Roadmap, which specifically goes into EHRs and the needs and the requirements of the system for an EHR. But many countries don't have a standardised EHR. Canada, Australia, America, lots of countries. It's kind of a rare thing to have a standardised EHR because it's often a very commercial space, which we're not in at the moment. Northern Ireland is rolling out EPIC, which you may have heard of. That's an EHR across trusts and also for community care as well. And we're linked in with our colleagues up in Northern Ireland as well. So we can often ask them questions or queries on things like that. Okay. Right, okay, I'm going to speed up a bit now. Okay, Challenges. Okay, so now, challenges. Demand for data versus resources, and that's the 2 guys on the screen there. We're either running in one direction or we're running in the other direction. It's trying to get that balance in between the quality and the quantity, and that's the challenge with any big data. So we have a 4-week coding deadline. We have an escalation process that feeds up into the REOs and we also submit an escalation report into the National Director of Planning and Performance, and all hospitals' coverage data is on those reports. It's open and it's clear. And the data is needed early, quickly. It's coded and uncoded, so these are the demands on the data now as it's being used. We do have challenges around valid activity and legacy wards and HIPE and things that might not get into HIPE now, but the system is 50 years old, so there may have to be some calls made around that as we expand out into OPD and ED. We see a reduction of new coders coming into HIPE, so Marie and the team have had to align their training courses around that, but we continue to deliver that training, but it is something that we see now, and it's a bit of a challenge in lots of ways. Standardised data collection, we want to report the same data across all regions in the same way so that we can provide that data with assurance out to data users. And I'll mention the clinical awareness now in a moment. Okay. Right, so I might go a little bit over now, but anyway. Identify issues impacting coding, throughput and quality. So this is the piece that I'm talking about around how you can enable your HIPE departments to really use their expertise, their skills, which take a long time to develop, how you can maximise those. And these are just some of the things that have come through on various work that we've done. But really there is a need for leadership and management support beyond just meeting coding deadlines. This is how your data is seen. So if the complexity is missing, if the activity is missing, if the depth of coding isn't there, that's a problem. That's a problem for you and your service. Reporting of valid activity only. Coders are asked to put in all sorts of things that aren't valid HIPE activity. So there needs to be support for the integrity of how your data is reported as well. Have a clinical documentation protocol. So can coders approach clinicians? Are coders supported to approach clinicians if they have queries where they're dealing with very complex cases or challenging documentation? That's something that's not too difficult to put in place. Also the quality of IPIMS and PAS data. There's a lot of queries over the times of that data, the discharge destinations. So can anything be done there to improve the quality of that data? The chart flow issues. Can coders get the charts? What state are the charts in when they come to the coders? And involving the HIPE teams in development around those EHRs and those systems that are going in. Just to ask your HIPE team, what do you think of this? They are experts in clinical documentation. Coding compliance with the classification, that's as read, and access to systems as needed. And also that management and leadership have knowledge of ABF impact and the trends. So what's going on in your service? What's happening? What are your top 10 DRGs? What's happening? What's going up? What's going down? Where's coded? Where's uncoded? Where are the challenges in the system? So trying to identify those blockages can help to answer them as well in a way, but we need to open the door and see what's happening in the HIPE departments rather than just have you met the deadline. So we're happy to help out with training needs, or if there's anything on the data quality side, we're happy to assist with that, and the whole team are very open to that. The PPSN Fiacre spoke about earlier on, so it's basically reiterating that we're ready to collect the PPSN when it's available, and we don't plan that the coders will capture it, that it'll come down from the PAS systems to HIPE. The IHI, again, that's when it's available, that will come through down into HIPE. And the air code, we are set up to accept the air code, and coders can also capture that. But it's still being worked on about the completion of that, and Fiacre mentioned that earlier on. And I just want to briefly mention another project we're involved in, and thanks to the HIPE coders across the country for participating in this survey with the Cost to Care Research Project in DCU. So they are looking at missed nursing care, and they're looking at building an education tool for clinicians around documentation and the importance of documentation. I'm happy to speak to anybody about that separately if they want to contact me about that. So I just want to say thank you to all my HIPE and NPRS colleagues. and those out in the system collecting the data users and all who contribute to HIPE and NPRS data, and our contact details are there. And apologies for going over for a couple of minutes.
Jacqui.
Thank you.
Thank you.